This video is only for educational purposes. No any clinical treatment shall rely solely on the basis of knowledge from this video. More than happy for the gaps to be fulfilled with correction for mistakes and lacking.
So let's start this, and and I would like to discuss is on the time time frame level. So at first, when the patient is born, we'll firstly give the vaccines BCG immediately after the born. So let's put here the time frame and the name of the vaccine over there. So time frame and immediately after the birth. And name of the vaccine immediately after the birth, name of vaccine. So I'll discuss over here, over this, I'll mention about the name of the vaccine. So BCG vaccine. I said that immediately after the birth, and if we miss that, if the BCG hasn't been given, so was that it should have been given just after the birth. Now we have not given the vaccine to the babies. Can we give? Yes, we can give that vaccine if the baby is up to the 1 year of old. Because this question may arise to the patient who haven't given the BCG vaccine or must or may have missed the dose of the vaccine. Then we can give that to the baby who is 1 year of old. So how many times do we need to give it? The vaccine, should it be stop only after the once or should it be repeated? So for the frequency, I'll mention it here. So frequency is just only once. And what is the route? How that is to be given? It is to be given intradermally. So we have only two vaccine that will give the intradermally, that is BCG vaccine and IPV vaccine for the polio, that will give intradermally. So there are only two. And what is the site? Generally we give that in the right arm. Okay, that is okay. We give BCG vaccine, we give once intradermally and the right arm. So doctor should know what is the doses. So doses is 0.05 ml, not the 0.5 ml. It is 0.05 ml. A person may be confused, not the 0.5 ml. Okay, to make it sure. So this is the route, this is the site, this is the dosage, this is the frequency, this is the name of the vaccine. And okay, so let's start other as well. Time frame, name of the vaccine, frequency, route, site, and doses. So we gave that vaccine. Then what is the next time that we'll give? So after this, maybe we'll have to wait up to the 6 week, and then we'll start the new vaccine. Most of them we follow 6, 10, 14 rules, like for the TPT, hepatitis B, and HIV, which is the pentavalent and also the OPV. So we'll follow 6 weeks, 10 weeks, and 14 weeks. So let's see which vaccines do we give at the 6 weeks. So we'll give 6 weeks pentavalent, and it includes diphtheria, pertussis, and tetanus, and hepatitis B, and Haemophilus influenza, HIV, for the prevention of HIV, meningitis, and pneumonia. So how many times do we give this pentavalent? We'll give that for the 3 times. This is to be given for the 3 times in the 6 weeks, 10 weeks, and 6 weeks, 10 weeks, and in the 14 weeks. And what is the, we have just given in the 6th week. Okay, this we have given in the 6th week. So what is the route of giving this pentavalent? It is intramuscular. And where do we give this? We give this in the left lateral thigh. In the mid portion. And the dose is 0.5 ml. We give this at the left lateral thigh because there is another drug which we will be giving in the right lateral thigh mid, and that drug will give also in the 0.5 ml concentration, and that also in the intramuscular. So we'll give pentavalent TPT, hepatitis B, HIV in the left lateral, but we'll give that drug in the right lateral thigh. So what is that drug? So what is that vaccine? So that vaccines that we give in the right lateral thigh is PCV. Okay, for the pneumonia. We'll also give it for the 3 times, but the duration is different. 6 months, 6 weeks, 10 weeks, and the 9 months. So this is also the vaccine that is given in the 6 weeks. Okay, because I will give at the 6 week, one in the left lateral, one in the right lateral. So there is also another drug that will give in the 6 months of time, and that are to be given not. This is the injection that will give, and now next two will be giving in the oral form. So oral form we have most common, that is oral polio vaccine. Okay, 7. That will give in the starting from the 6 weeks. We will give for the 3 doses, just like above in the 6, 10, and 14 weeks. So oral means oral. So what is the drops? We'll give 2 drops, and also we'll give the next drop. But that we'll give for the 2 times, 6 week and 10 weeks, no 14 weeks or something else. Okay, so that will give in the rotavirus. For the rotavirus, we'll give these drops to prevent the diarrhea. Okay, new BCG for the pneumonia, BCG for the TB, or for the polio, and the diarrhea, most common cause of diarrhea in the children. Oral, and this also 2 drops. So these are the vaccine that we'll give in the 6 weeks time interval. So we'll go towards 10 weeks period. So when the baby is born, immediately after the baby is born, the guardians should keep in mind that they should give the BCG vaccine, and if they have missed, they do not need to panic, because they can be given up to the 1 year of age, and it is to be given only once intradermally in the right arm, and that is 0.05 ml. Then after the 6 weeks, when the children be 6 weeks old, then we must be conscious that the 4 vaccine is to be given. That is the pentavalent IM on the left lateral thigh, while the PCV on the right lateral thigh. I have made a mnemonic for the pentavalent, that it consists of DPT, hepatitis B, and HIV. That is DPT, Hebre, and Hebre to be given in the Debre. And next is given to be Dyne. So Hebre to be given in the Debre, left lateral thigh mid 0.5, PCV pneumonia 16 at there, and we must not be confused with this in the 9 months. That is to be given in the 16 and 9, and most of them have to be given 16, 14, 16, 14, 16, 14, not to be given into the 14, not to be given in the 14 in the 9 months. So intramuscular 0.5 ml, 0.5 ml. So we will have, most of them will have 0.5 ml of doses, except for the BCG vaccine will be given in the 0.5 ml, and the next one is the polio IPV. That is to be given in the 0.1 ml. Otherwise, everything is for the 0.05 ml. We must be remembering the two doses. And the next is the oral drops. They are to be given in the 2 drops formula. Okay, in the 10 weeks, so what were the things that will be given? We'll see from the above. What were there? 16. So, as mentioned, we'll give pentavalent second dose, DPT, and HIV. So 3 dose, 6, 10, 14. So 6 dose was complete, 6 dose, 6th week complete. Now 6th week, 10th week it's complete. Intramuscular, DPT, Hebre, and hepatitis B, and HIV, Hebre, Debre. Left lateral thigh mid. .5 ml. And next is PCV for the pneumonia. So this is to be also given in the three times, 6 week, 10 weeks, and not the 14 weeks, but the next 3rd dose is to be given in the 9th month. So 6th and 10th completed. That is to be given in the IM as pentavalent left lateral thigh, DPT, Hebre, they to be given in Debre. This is to be given in the Dyne. So right lateral thigh, right lateral portion of the thigh, and in the mid region. So this is also to be given 0.5 ml. As I said, only 2 drugs, do not follow 0.5 ml rule. That is BCG 0.05 ml, and the next is IPV, which is to be given as the 0.1 ml. And next also we have to be given in the rotavirus. Sorry, as I'll like to follow the sequence as mentioned above, that is polio, OPV, 7. This is also to be given 3 times, 6, 10, 14. 6 completed, 10 completed, 14 remains. This is to be given per oral, and 2 drops. And we have next rotavirus for the diarrhea. This is to be given 2 times, right? This is the 2nd dose and the final dose. No need to wait for the next dose. So this is completed. Rotavirus is completed over here, and we have also finished the BCG vaccine here. We have completed the dose over there. So we have completed this. This is given per oral, 2 drops. So after the 10 weeks period, we have completed the doses of 2 vaccination, that is BCG vaccination and the 10 weeks rotavirus vaccination. So 6, 10. So these are the 1, 2, 3, 4 drugs that will be completed. So 10 weeks we will be just following up the remaining. So next time period, what is the next time period for the next vaccination? 6, 10 and 14 weeks. 6, 10, 14. So this is the pentavalent. DPT, hepatitis B, HIV, Hebre, to be given in the Hebre. 3 dose, that is to be given on the 6, 10 and 14. So we have completed the 3 dose over here. So this is also completed. So this is also completed on the 14th weeks. So what was the route? Route was in the Hebre, left lateral thigh mid, and the concentration is 0.5 ml. As I said, only BCG that contains 0.05 ml, and polio in the form of IPV is to be given 0.1. So these are the IM. And also we must be sure that only 2 drugs which are not given in the 0.5 ml. Only these are the drugs which is not given in 0.5 ml. Route are also not the same. It is intradermal. All the drugs that we give in the IM are in the 0.5 ml, but the drugs that we give intradermally are very in the low concentration. So we can also remember by this. So intradermal is 0.05 ml, and the next one is 0.1 ml. They are to be given in the low amount than the regular which we give in the intramuscular. So intradermal is 0.05 ml. We'll discuss about that when that time will come for the injection of for the implementation of IPV vaccine. So pentavalent we have completed, and the next one is the PCV. But will they give that vaccine in the not in the 14th weeks? Will they give that the 3rd dose in the 9th month? And the next comes the OPV. So now let's finish the OPV. But when we'll give the last dose of the OPV polio vaccine, we'll be starting the next route of vaccination for the polio. That is by the intradermal injection. 6, 10, 14. So we have completed 6, 10, 14. So we have completed this OPV 3rd dose in the 14th weeks. Per oral 2 drops. So by the 14 weeks, 6, 10 and 14, we have completed the dose of oral polio vaccine. We have also completed the pentavalent TB and HIV. So these 2 were given in the 6, 10, 14, and also we carried the 6 and for the rotavirus completed in the 10th weeks. So in the 14th week, we have finished the oral formulation of vaccination, but we'll start the injection form of vaccination, and that is IPV for the polio. We'll start this in the 14 weeks and complete the next dose in the 9 months. 14 weeks and 9 months. So we'll give that 9 months along with the PCV vaccine. But this is to be given intradermally. Where? Intradermally in the left arm. And this is 0.1 ml. Intradermally. So intradermally are also given in the, these are very few ml, 0.1 ml, while other rest were those which are given IM were 0.5 ml, but this intradermal is 0.1 ml and this intradermal is 0.05 ml. So there is no any mnemonic which one is the right and left, but we will see first everything that we'll give in the right. Okay, so we'll try to give the first vaccine in the right. So intradermal in the right arm, while this in the left arm, because it is given later, so in the left arm, and there is no any specific mnemonic for this, why it has been given over there, I don't know. So just for the mnemonic version, first we'll give in the right arm intradermally, then we'll give the left arm intradermally, because we will always start from the right. And now next is that, okay, for the 14 weeks these are the things that will complete by. Now next we'll go for the 9 months duration. As we have already completed, I also mentioned to forget to mention that PCV, IPV. Okay, these are the things. In the 9 months, what were the remaining? So in the 9 months that were left to be given was the PCV. For the pneumonia, that was given in the 3-dose form in the 6 week, 10 week, and not on the 14, but was waited up for up to the 9 months of age. So we have completed the 6, 10 and 9, and we have already completed this vaccine PCV in the So we had been using this vaccination intramuscularly. And the concentration is 0.5 ml. And for the next 9 months of vaccination, we will see that what is to be left IPV. This was given in the 14 and 9 months. So in the 14 weeks that was given, when the OPV was finished, the IPV was started. That is how it is given, IM, and as the BCG was started in the right, it is started intradermal in the left. And they are 0.1 ml because those, intradermal, those who are given intradermal have low dose, and only 2 vaccines are given in intradermal, that is IPV and the polio. So that was 0.05 and this is 0.1, not 0.5 ml, not 0.5 ml. So this is the things that will complete by the 9 months. And also now at the 9 month we have not only complete, we'll start some other vaccines as well. So what is that vaccine that will start is the MMR, but MMR, measles, mumps, rubella. Mumps, rubella, but nowadays we give only for the measles and rubella MR vaccine. So MR vaccine nowadays. So it is to be given in the twice, 9 month and the 15 month. So when you vaccine for PCV and IPV is completed, we will also start the next vaccine, that is measles, mumps, rubella. So IPV was started from here. We'll start IPV from here. We'll start measles, mumps, rubella from 9 months. And most of the vaccines, pentavalent, were started from 6 weeks, and rotavirus were started here. We have no vaccines to be started on the 10 months. We'll just be following up. So immediately after birth, we give one vaccine. We will start at the 6th week. We will not start any vaccine in the 10 weeks. Just we will do the follow up. We will start the IPV vaccine in the 14 weeks. In 9 months, we will start the measles mumps vaccine. That is to be given twice, at the 9 month and the 15 month. And how it is given? It is given subcutaneous. The measles, mumps, rubella, and the Japanese encephalitis. The time period from the 9 months and the 12 months. So this is little bit different than any other vaccine. This is to be given at the subcutaneous. So I'll highlight this with the subcutaneous with the blue one. So here we'll give this subcutaneous vaccine. We'll give this in the left arm upper. So we'll be given 2 vaccines. One is the intradermal left arm upper and one in the subcutaneous in the 9 months. So every vaccine is the 0.5 ml, except for the vaccine that is given intradermal, that is IPV and the BCG vaccine. And we have 2 vaccines that will give subcutaneously. That is for the Japanese encephalitis and the measles rubella, that will give subcutaneously. One in the left arm upper and the another in the right arm upper. So measles, mumps, rubella in the left arm upper. And the next we'll give in the 12 months. That is Japanese encephalitis only once. We'll give this only once at the 15 month. And this is also given subcutaneously in the right. Before we gave that in the right upper arm, now we'll give in the left upper arm, now we'll give in the right upper arm. This is also in the 0.5 ml. So the subcutaneous will give blue highlight. So only these are the drugs. And next we'll follow in the 15 month. So this is also completed. So Japanese encephalitis, this has also been completed because it is given only once in the 12 month. Now in the 15 months of age of the children, we have the remaining vaccines to be given. Which vaccine was given? Left to be given, that is measles and rubella. MR vaccine, measles, rubella. I mean MMR, but not measles, mumps is not given nowadays. So only MR is given nowadays. Before, if it was given 2 times MMR, now twice. And this is on the 9 month and 15 month. 9 months, 15 months, sorry. Yeah, it was not given in the 15 months, sorry, over here. So 9 months and 15 months, and the dose is completed at the 15 month for the measles and rubella. So this is completed in the 15 month. So what was the dose? The dose was subcutaneous for the left arm, upper, and 0.5 ml. So I'll highlight this because this is to be given in the subcutaneous. We'll give the subcutaneous drugs, two vaccines, that is Japanese encephalitis and AMR. We'll also start the new vaccination over here at the last, that is for the typhoid. In the 15 months, and that is only one dose. Once at the 15 months, we'll give this time. The dose is completed, and the dose is completed by this time. And also the MMR is completed. So what is the route? Nothing. It is the same as before. I am intramuscular, and where do we keep it? So it's in the left arm, upper outer. So every vaccine that we'll give in the 15 month will be on the left side, because we are going to leave all the vaccine. These are the vaccine that we'll give, and rest is for the mother. So I'd like to write that in the different ink. This is for the mother: tetanus toxoid and tetanus and diphtheria. So this is for the mother: tetanus and diphtheria, where to be given tetanus and diphtheria at what time? So this is at the pregnancy, and the mother is pregnant. First dose after knowing. So what are the doses that are to be given? This is to be given in the pregnant, 2 doses. Once when the non, first when the pregnancy is known, and the second after 1 month. And it is also to be given IM. So this is also going to be the last drug that we'll be giving. So left arm upper. .5 ml. Sorry about the previous one. This was not on the left arm upper, but this was going to be on the left thigh, because we are already giving one subcutaneously. So this is going to be on the left thigh, one in the left arm and one in the left thigh. So thigh for thigh, typhoid, thigh. So this can be the mnemonic: typhoid thigh, and the left upper arm 0.5 ml. So this is to be given 2 times. So these are the drugs these are the vaccination that is to be followed. There's been 2 mistakes in the previous slide. So we'll give the Japanese encephalitis in the right upper thigh. Okay, not in the arm. We'll give that in the right upper thigh. So this was a mistake. We'll give that in the right upper thigh. And we'll give the typhoid in the left thigh. So, and these are the drugs that is given for the first time in the 12 months, only once, and for TC for the typhoid also we'll give for the only once and the first time. So in the 12 months we'll give in the right upper thigh for the Japanese encephalitis, and we'll give in the left thigh typhoid for thigh. Also the Japanese encephalitis also will give in the thigh. So we'll give this subcutaneously, while we give this intramuscularly. So this was the mistake that was occurring while I was preparing in the previous slide. But also I did mention with the sign, with the asterisk sign. I also did mention during the playing of the slide. So please reconsider this. And I'll also like to highlight that the Japanese encephalitis is given in the right upper thigh subcutaneously, while the typhoid thigh, so left thigh. As we are going to leave the vaccination program, so this is will be the left. So as this is the end, we'll be leaving the vaccination program. So left, and the Japanese encephalitis right upper thigh. So